Hello, thank you for joining us today. My name is Amanda Clark. I'm the marketing manager for UBMD Orthopaedics and Sports Medicine. We're doing our very first Facebook Live today. So we're hoping that some of you are going to be submitting some questions while I ask our guest here, Dr. John Leddy, some questions that he gets asked by our patients frequently. So Dr. Leddy is the medical director for the University at Buffalo's Concussion Management Clinic. He's also a primary care sports medicine physician with UBMD Orthopaedics and Sports Medicine, and he's here with us today to answer some questions. So welcome, Dr. Leddy.
Thanks, Amanda.
All right, so let's roll right into the questions. So when did you first get involved in concussion research and treatment, and what made you want to get involved in that?
Well, basically, it was because I've been a team physician at UB, the University of Buffalo, for a long time now. And as I'm not a surgeon, but doing primary care sports medicine, I was on the sidelines a lot, seeing concussions, whether it's football or soccer or wrestling. Mm-hmm. And then I noticed over time that some of the athletes weren't getting better. And back in the 1990s and 2000s, in the earlier part of this decade, the recommendation was to tell people to rest and to do nothing until their symptoms went away. But clearly that wasn't helping some of the people we had with us, especially the athletes. So there's another researcher in brain injury here at UB, Dr. Willer, Barry Willer, and he and I came up with the idea to try to exercise athletes after concussion who weren't getting better, but in a safe way in a safe way, so it didn't make their symptoms worse. So we came up with the idea of doing a treadmill test to test their exercise tolerance, we called it. And then we would see how much exercise they could do and give them an exercise prescription at a level below that which exacerbated their symptoms. And we found in some small observational studies that helped them recover. And so now we're actually studying why that may be, okay, why people can't exercise after concussions and why low level of exercise might actually help them recover.
Great. So concussions themselves, I guess, what happens to the brain when somebody gets concussed?
Okay, so a concussion is a force transmitted to the brain, most often by being hit in the head, or your head is hitting something like the ground, or from, say, getting whiplashed very hard. Say, in a football player, for example, being blocked in the back, or a hockey player being checked, and the neck whiplashes back and the head gets shaken up. So it's the actual shaking of the brain in the skull that causes the concussion. So you can think of it as this mechanical energy being transmitted to the brain, and then what happens in the brain is a series of biochemical and metabolic events, okay? Changes in neurotransmitters and ions and nerve conduction and brain blood flow that then produces the series of symptoms that people experience after concussion. And the symptoms usually come on very quickly. Sometimes they're a little delayed. Usually we don't think more than 24 hours. But those include headache, blurred vision, dizziness, trouble concentrating, trouble remembering. Most people, or some people, think that you have to be knocked out to have a concussion. That's not true. In fact, in most athletes, they don't lose consciousness. So a concussion is a disturbance of brain function caused by the brain being shaken up, and then the symptoms that evolve after that.
Right. Is there a certain age range that's more prone to concussions?
Well, it depends on what the cause is. So young kids, 6, 7, 8, 9, are most commonly concussed by falls, so just falling. Adolescents who are playing sports, the most common reason they're concussed is because they're in some sort of sport. Again, things like hockey, football, soccer, wrestling. But any sport can have a concussion. I've seen tennis players and swimmers get concussions. So it happens in any sport where you hit your head or you get a whiplash type of injury. Adults is a mixture. It's often injuries at work, sometimes car accidents, but also sports.
Is it more difficult for an adult to bounce back, a child to bounce back, or does age not really play a factor?
We used to think that the younger kids had more trouble bouncing back from a concussion, but it turns out it's probably the adolescents, the 13 to 16-year-old age group, that has more trouble recovering from concussion. Why that is not entirely clear. The bodies and brains of adolescents are going through a lot of changes, and one of the things that we know that changes during that time a lot is something called cerebral blood flow, or brain blood flow. And we think that's one of the major causes of concussion problems. And so if that's changing a lot during adolescence, and it's very variable, it may predispose some adolescents to having trouble recovering from a concussion. But also think about it, they're also in a stage where they're learning a great deal, and they go to school, and they have sports, and there's a lot of social commitments, so there's a lot going on. And so they have a lot to recover from, in a sense.
Mm-hmm. No, definitely. So if I'm a parent and I think that my child might have a concussion, or somebody that I know might have a concussion, what's the best course of action for them to take right away?
So right away, if you think your child may have had a concussion, the best thing to do is remove the child from the at-risk activity. So if your child plays soccer, for example, and she comes home and is reporting headache and dizziness after a game or a practice, the best thing you can do is take her out of the sport and get her seen by a doctor. And that could be your primary care doctor or a concussion specialist, depends on where you live and how comfortable your primary care doc is with evaluating someone who's concussed. But the main thing there is that you don't want to let the child or adolescent go back and play, because we know now there are several studies showing that even playing during a game after a concussion, even if you don't get hit again, prolongs the recovery or delays the recovery. It makes the symptoms worse. And it becomes even worse if you continue to play with concussion symptoms and then you get hit again.
Right.
So we know that's injuring an already injured brain makes the severity of the injury orders of magnitude worse. And so they really, really have trouble if they get hit twice in the same game or practice. So the safest thing for the athlete and the parent to do is take them out and then have them evaluated by somebody who knows how to evaluate a concussion to make sure they've recovered. You can't just say someone should rest for a week and the concussion's over, okay? Because they're all different. Some of them last a few days, some of them last months. And only somebody who is following the symptoms and doing a physical exam of somebody, and sometimes other tests, knows when that kid is recovered.
Okay, so I know that some people ask, should you get an MRI after a suspected concussion? What would you say to people that ask that?
So what we know from some studies and from just clinical experience is that most kids and adolescents who get a concussion do not need an MRI of the brain. Okay, an MRI is really only indicated if the injury is so bad that at the time the child is seen, say, in the emergency room, they have a severe headache that's not getting better, they're throwing up. If they had any kind of problem with their neurological examination on that day, then they'll probably get a head CT scan or an MRI. Usually by the time the doctor sees the patient in the office or the clinic within a few days or a week, unless the symptoms are getting worse, you don't need to get an MRI because the MRI is always normal. But if someone's headache is getting worse, they're not responding to just relative rest with symptoms at least improving, if not gone, but at least improving, or there's anything very unusual on the neurologic exam that the doctor does, then an MRI will be obtained. But that is the vast minority of cases.
Right. What about going to sleep after a suspected concussion? Because I've heard before that you're not supposed to go to sleep if you got bumped on the head. And is that true?
Right. Again, not really. Turns out kids need to sleep after concussion because their brain needs to recover. If someone was really concerned, and if it was a pretty bad concussion, and the parent was concerned, they might in the middle of the night just make sure their child was arousable and could wake up. But generally we don't advise that anymore. There's really no indication that it helps or prevents any problems. The biggest indication to return someone to the emergency room, say, is if in the next few days they're just not getting any better, and the headache particularly is getting worse. So worsening headache is one sign that the child should go back either to see the doctor or maybe to the emergency room. They might have to do a CAT scan at that point. But after most concussions, that won't be necessary.
Mm-hmm. Right. Well, I want to remind our viewers that you can submit questions by filling out the comment field, any questions that you want to ask. But I'm going to continue asking questions, and this topic is on prevention. So, we all know that helmets are strongly encouraged, mouth guards encouraged to prevent head injuries. So, I guess, how effective is the safety equipment that we're having athletes wear? And can they prevent concussion?
Right. So, as far as helmets go, helmets were designed originally to prevent skull fractures, okay, which they do very well, okay. But they don't prevent concussions because a concussion is not a skull fracture; it's the brain being shaken up.
Right.
And if you ever look at a TV footage or film of how concussion occurs, say it's in football, two heads collide. What you'll see is the head gets rotated or decelerated very quickly, and so they don't wind up breaking their skulls, but they still twist their neck or rotate the head, and that's when the concussion occurs. So helmets can't prevent that. Mouth guards are good to wear during contact sports. There's some emerging evidence that they actually may be helpful, but most of the studies that looked at that show no change in concussion incidence wearing mouth guards. Now, that doesn't mean they shouldn't be worn, because their primary purpose is to prevent broken teeth, and for that they're very good. So we don't have any sort of concussion-proof helmet or headband, or mouth guard yet. Helmets right now are worn in contact sports mainly to prevent skull fractures, and mouth guards are used for dental protection. So the main thing in terms of preventing concussions is rule changes and style of play. So you'll probably notice in football they changed where they kick off from now, so that the chance of running back a kickoff is reduced, because they studied professional football and found that a lot of concussions were happening on special plays like kickoffs. So they changed the rule, and they actually had a reduction in the number of concussions. So that works. Yeah. The other thing is style of play. So if you have if you know a kid on your team who's always tackling with his head, well, he's more likely to get a concussion than someone who's not. Right. So it's changing behavior on that type of level that might help. Now, we don't have any big randomized controlled trials to show us that works yet, but that makes a lot of sense, and that may be coming down the pike. So it's really rules and style of play that can help prevent concussions. So, kind of shifting into questions about CTE, what exactly is CTE? Because we're hearing a lot about that on the news, on ESPN, hearing it all over. So what is CTE? Okay, it stands for chronic traumatic encephalopathy, and what CTE is what's called a neurodegenerative disease. So sort of like Alzheimer's disease, over time the brain actually deteriorates, and it loses volume, it loses neurons, it loses connections, and people will start to have emotional problems, cognitive problems. I can't remember things, I'm impulsive, I'm depressed, this type of thing. CTE is a complex issue. It's really only beginning to be understood. There's a lot more we don't know about it than we do. So there are ongoing studies. The studies that have been done in the past have raised questions about, for example, does playing contact sports cause CTE? And it seems like maybe the only cause of CTE, or one of the main causes, is repetitive head trauma, okay? Because there are animal models that show that. And it looks like from the research that's been done on a case series of retired football players, for example, or deceased football players, because you can only diagnose it right now after death. There's no way to diagnose it during life. And that's one of the problems, is because the data we have on CTE is only obtained post-mortem. And so you have a picture of what CTE looks like in the brains of players who've died. And then what you're trying to do is relate that appearance to their behavior during life.
Right.
And that can suggest an association, but it does not prove that one causes the other, okay? That is not high up on the hierarchy of level of scientific proof for a risk factor causing a disease. The only way we'll ever know does repetitive head trauma cause CTE in, for example, football players, hockey players, is to have a way to diagnose it during life and follow patients over time to see what happens between those who have head injury, those who don't, and those who have head injury and get CTE, and those who have head injury and who don't get it.
Right.
I suspect that there's a small percentage of the population that has a genetic predisposition to this issue, that if you put them in the environment of hitting their head thousands of times, they'll have a problem. Okay, but we don't know how many that is, and we don't know who it is. So this is being studied, and it should be.
Yeah.
But again, we don't know which players are going to get it, if at all. And we don't know, frankly, if CTE is a disease itself or a marker for another problem.
Right.
Okay, so there's so much to be learned about it. And parents will ask me things like, well, this is my son's third concussion playing hockey. You know, he's 17, and he's had 3 concussions now. Is he at risk for having CTE? And I say, no, he's not. For what we know now, there's no indication that your son would be at risk for CTE. He didn't play professional football in the 70s, 80s, and 90s, where concussions weren't even treated back then because nobody really thought they were an issue. And there are other issues involved with the deceased players that have been diagnosed with CTE. A lot of them had family histories of psychiatric disease, and there may have been other problems going on in their history with substance abuse, things like that. So it's a very complicated issue. But what I do know is that if you have a child who's had concussions, but they've been treated properly, they've come out, they've rested, they've not gone in while still symptomatic, there's no evidence whatsoever that they are at risk for CTE.
Well, that's good news. Yeah, so you answered my question. So how can my child get CTE? So it's basically...
you know, if you want to pound your head with a hammer every day for the rest of your life, you might get CTE.
Right.
But in 2017, you know, if you're honest about your symptoms, which is the most important thing for kids, you know, is that athletic trainers and doctors and nurse practitioners and PAs can't diagnose a concussion unless you're honest about your symptoms. And sometimes we can see on a field where someone's really having trouble and we'll take them off. But if you get, if a kid gets hit in the head and he or she is dizzy and they don't tell anybody, that could be a concussion, but nobody's going to take you out unless you are honest about the symptoms.
Right.
And that's the best thing you can do for your health, because like I said, to play with a concussion is the worst thing you can do. It just makes it much more likely you're going to get another more severe injury that day, and then you're going to miss weeks of school maybe, and maybe months of your sport.
Right. Okay. So again, as a reminder, if you have any questions, feel free to submit them in the comment field. So right now we're going to talk about the research that's being done at the University at Buffalo. So how long have you been doing research at UB?
We've been doing research about 10, 11 years now. So the clinic was formed with the idea of providing good care for concussions, but also advancing the field. So back when I told you we first started thinking about the college athletes who weren't getting better, we tried to come up with a way to help them. And so we thought, since athletes exercise, why not try to help them at least return to exercise, but in a safe way. So we had the idea of this treadmill test, which we borrowed from the cardiac treadmill testing world. It's the same thing they do with patients who have heart attacks. So since that time, we've been interested in why patients having trouble exercising after concussion. Why does exercise help them? It's because concussion, while it starts out as a brain injury, isn't just an injury to your brain. The brain controls everything. So the concussion actually affects your heart, your blood vessels, your muscles, your breathing. It affects a lot of things, not just your thinking. It affects your eyesight. It affects your balance. And often there's a neck injury associated with concussion that can also give you symptoms. So all these things have to be evaluated. But we've sort of taken a more active approach to treating concussions, especially in those who don't get better in the usual time frame. So we do a thorough evaluation to find out what's causing the symptoms. And then we try to treat that. So if, for example, during the evaluation we put them on a treadmill and the athlete can't go to the point he or she should, we will give them what's called subthreshold exercise to try to improve that. Now we have a study going on where we're randomly assigning some kids to exercise or stretching because we don't know what part of the exercise or what type of exercise is even better. So that's an interesting study. So if you have a concussion and you come to UB, you might qualify for that to see if early intervention helps you recover faster. The other one we're doing is supported by the National Institutes of Health. And this is really to look at what I like to call the physiology of concussion. So physiology means how your systems integrate to allow you to do things like exercise. Okay. And what we know is that after a concussion, a child or an adolescent has trouble exercising. The symptoms get worse. Okay. Nobody really knows why that is. Okay. I think it's because there's a part of your nervous system called the autonomic nervous system that is responsible for your blood pressure, your heartbeat, your respirations, that gets damaged, and that just disturbs the control of brain blood flow. Okay. And what we know is that at rest, when you're just sitting around, the brain blood flow after concussion is too low. Now that may be why some kids have trouble concentrating and why they feel fatigued. But then when you try to exercise in that same time, it looks like the brain blood flow goes up too high. And so that produces symptoms like headache and dizziness. So they have to stop exercising. So we want to know why that's happening. So our study now is to take adolescents who've had a sport concussion, so age 13 to 17, and if they got hurt in a sport within a week or so, they would do this exertional test, and we would measure their brain blood flow, and then we would also do that in an MRI. They get an MRI.
So they'd get on the treadmill and you'd measure...
In this case, it's a bike.
The bike, okay.
Yeah, but it's the same principle. We take their exercise up in a gradual way, and we see where they get their symptoms, and we stop that. But then we're looking at things like how much blood their heart is pumping out. We have a finger device, which is put on their finger, measures what's called their cardiac output. We measure their breathing. We measure the carbon dioxide levels in their breath, because that relates to the control of brain blood flow. And then we put them in an MRI and we measure the brain blood flow lying and tilt it up a little bit, because that's a bit of a physiological stress. So they get a free MRI out of it. They get paid for their time. It's not bad.
Yeah.
And it's a really interesting study. So we want to study them when they're having symptoms and then when they're recovered and compare the two.
Right.
Okay. And it's important to do the recovery part because we want to know that this physiological disturbance has returned to normal. We want to see that it's actually gotten better. The brain blood flow control has resolved. Because then we know you're really ready to start the return to play.
That's great. So how long is the study going for?
It started last year and it's going for 4 more years. And so sounds like a long time, but it'll be over pretty quickly, I think. And we don't want kids to get concussed, but if they have a concussion during sport, I think this is a good place to come because we're used to treating athletes and getting them back, and they have a chance to be involved in a really neat study and get paid for their time, and they get a brain MRI that's free for them. So it's not a bad deal. Right.
No, it's great that you're here and your team's here to take care of these kids and adults and anybody who has a concussion. So to get in touch with our concussion clinic, our phone number is 716-829-5499. You can call that number. I'll say it again at the end. But I just want to ask if we have any more questions. Anybody submit any questions? Not yet? Any last minute? Well, thank you, Dr. Leddy, for answering these questions. Again, the phone number is 829-5499, area code 716. You can visit our website, ubortho.com, for more information. And we're hoping to do more of these. So if you're viewing this now or viewing this after it posts and you're looking for a topic, anything sports medicine or joint replacement, bone surgery, any topics like that, just let us know what you're interested in. Thank you.
Thanks.